So we brought together NHS leaders and service redesign leaders. We've brought innovators together and clinical entrepreneurs, all with the idea of helping innovators bridge the gap between their initial success to that scale-up success. You know, the thing that really gets the device, the platform, the app into patients' hands and does benefit for population health, but also the workforce as well.
We can draw on the experience that we had from working across the pandemic or in the acute phase, thinking about virtual wards, digital access, and now allowing patients to do things differently that work for them, that actually also enable things to be done more efficiently within the NHS.
I think the two areas that we need to really see a bit of change and narrowing of that gap is, one is just being a bit more open to how new technologies can help, and the second one is just trying to get those forums going a bit more so that we can actually offer support to people that are needing help in different areas.
I believe we need to bridge the gap in the sense of just listening to more human voices, more of just understanding that, well, we need to listen to the experts in themselves because everyone is the expert in their own experience.
AHSN interactions is really important for us as part of that whole process, to get a message across that there are people who can help the entrepreneur in trying to tackle and navigate their way through all of these different difficult areas. I think is a really good opportunity.
Biggest gap we need to bridge is actually organisations who buy services like this being bolder in what they do and actually looking to deploy technologies at scale. What we need to do is get the evidence base and then be able to actually scale that to give them maximum benefits, because at the moment we don't see very few technologies used at scale within the NHS or social care.
So it's really urgent that we do this now. We have got a significant pressure on the NHS and we really need to come together, as well as harnessing the absolute energy of industry at the moment and our innovators to make a difference for patients in the NHS.
It is absolutely possible to be successful, to have the NHS buy your product, your device, and to get it into the hands of patients or staff. But the AHSNs are absolutely the organisations that can help innovators achieve that.